A very good morning, good evening, good afternoon to everyone. So I'm here today to speak to you about an important aspect in renal transplantation, that is eligibility for the kidney transplant. So at the outset, I would like to thank the Kidney ORS Foundation for giving me this opportunity to speak in the esteemed conference. And I also thank Mrs. Vasundhara Raghavan for giving me this opportunity. So in the next 15 minutes, let me take you through certain salient points which may help in some or the other way as to how to be known that whether you're eligible for renal transplant or not. I'm Dr. Manjusha Adla. I'm Professor Head, Nephrology, Gandhi Medical College from Hyderabad, Telangana State. So this is a basic question, like whenever you are on dialysis, like at the end stage renal disease on dialysis, when there is an option for transplant, we are in a dilemma to think about whether we are a candidate for a transplant or not. So how to decide whether a person is an eligible candidate for transplant or not. So there are certain salient things that need to be known. So like, let's look at the salient factors such as the age of the recipient or the age of the patient, the psychiatric illness, if at all, if anything is present, the serological status as far as the viral infections are concerned, underlying cardiopulmonary or the liver diseases, if at all anything is there, we need to rule out, financial status of a patient, which is very important, and of course the other scientific elements such as lower urinary tract abnormalities, malignancies, nutritional status, which is in fact very important and pertinent, and immunological compatibility, which in fact is crucial. So I would like to deal with the first 5 of the characters or the criteria which I had mentioned in this table. So let me take you through what does the Bible of the nephrologist say about the age. So should the younger age undergo renal transplant? Should it not? Should they not? Or should the elderly undergo transplant? Should they not? So the question is, it is recommended that age should alone not be taken as a criteria for transplantation, meaning to say an age factor, which is a mere number, should not be the criterion based on which you decide whether the patient should go in for transplant or not. But at this point, ladies and gentlemen, I would like to bring to your kind attention that elderly age are more prone for development of infections as well as cardiovascular events. So keeping this in mind, we have to enlist any patient. So this is a recent movie which everybody must have seen, where age has no bar with respect to the expansion of the family. So similarly, the age was not given much of a preference as far as the organ transplantation is concerned. That means age alone doesn't have any role. We should take age in addition to other coexisting ailments of a particular patient. Mind you, of the cardiovascular events as well as the infections vulnerability in elderly as well as in children. So with the duration of dialysis, the question, if I'm on a long duration of dialysis, am I eligible for transplant? In fact, studies say if you're more than 10 years also, the outcomes are equally good. So do not worry if you are more than 10 years of dialysis, you are very much eligible for transplant. In fact, in certain enlistment organizations such as like ours in Jeevan Dan, the vintage of dialysis is taken as one of the criterion to score for the priority of allocation of the organ. So the longer the duration, you are easily allotted a case. You are easily allotted a kidney. So what I mean to say is the vintage also does not come into picture when you think about the duration of the dialysis. When you come to the other side of it, like teenagers and the young children, in fact, you should understand that the science has developed in such a way that even a 6 kg child or a less than 1 year child is also subjected for transplant in Western scenario. But with us, by and large, it is considered that 10 kg should be there. But most of the studies have said that it is the teenagers, that means about 12 to 18 years of age, is the largest group of pediatrics who undergo renal transplantation. And if you take the 70 years age, the older age group, in fact, if you're concerned about the renal outcomes, it is being said that the renal outcomes, that means your graft is going to function, your transplanted kidney is going to function equally normally as in the young adults. Coming to the second factor, that is the psychiatric illness. If anybody, that means a patient of CKD, is much more prone for development of depression, anxiety, and other psychiatric disorders. So if it is present, am I eligible for transplant or not? So if it is an unstable psychiatric disorder, like mood swings, some bipolar disorder is there, then probably you're not eligible for transplant unless you're treated enough and a psychiatric clearance is obtained. And of course, the other side of it is like substance abuse, which is not a very common scenario in Indian context. But then we need to know that if it is unstable psychiatric disorder, then we may not be eligible for transplant. If there are suicidal tendencies in the past, again, there is a caution about undergoing transplant. So all these things, in fact, we have personal experience about this. So if the patient has an unstable psychiatric disorder, patient may not be eligible. Otherwise, a mere element of anxiety, depression should not prevent you from going ahead with transplant. Then, of course, this is a very salient one, which is a crucial pillar for the successful outcome of a transplant. You have to be strict with your drugs, diet, everything. For this, you have to be adherent, showing adherent behavior. If it's not, then you need an adherent counseling. So adherent behavior is very crucial for a successful outcome of transplant. In fact, this also comes as a part of psychiatric assessment. Okay. So coming to the third element, that is serology. All of you know that many viral infections are very common in patients on dialysis, which are transmitted across in the blood unit, in the dialysis unit, such as hepatitis B and hepatitis C. Of course, HIV, we do not have much, but less in number. So if you are hepatitis B and C positive, definitely a need for the gastroenterologist opinion is needed. We need to assess the viral load. And of course, this doesn't prevent us from going ahead with the transplant, but then a clearance from the gastroenterologist who assesses whether you need a therapy or not. If your viral load is significant, then probably you need a therapy. You need a therapy before transplant, or is it after transplant? In fact, in HCV infections, it has come up that you can take treatment even after the transplant. So the clearance of the virus, whether it should happen before the transplant or after the transplant, and if liver infection is there, is it acute, is it chronic, and is it decompensated or not? So all these things are definitely crucial for us to know before going ahead with transplant. So what is suggested is we need to have a hepatologist or a gastroenterologist clearance before going ahead with transplant with respect to the liver functions and liver structure, the viral load, and the treatment strategy. Then the other element that is of concern for us is whether a patient has an underlying cardiac disease, pulmonary disease. So if a patient has got a pulmonary disease, can he go in for transplant? The assessment needs to be done again by the pulmonologist, because if your lungs are not working properly, then you may not be a fit candidate for anesthesia. You may need a long time on post-ventilatory recovery. So all these things will add on to a delayed recovery and delayed renal function, loss of graft, and also the patient survival may be compromised. So in view of this background, we need a pulmonologist opinion. Basically, they will look at the chest x-ray, the pulmonary function test, and say whether you're good, you're able to tolerate, and you can go ahead with the transplant or not. So pulmonary clearance is definitely crucial for us. But mind you, at this point, I would like to bring to your attention that if you are a current smoker, please stop smoking. Smoking is definitely injurious to health, and smoking, if it is there, I think you should stop. If you're planning for a transplant, please stop smoking. You should not be a current smoker. And after you undergo transplant, I think you should never smoke, because smoking is going to cause a graft dysfunction. And of course, the other elements are going to become more prominent if you continue to smoke. So stop smoking if you have taken a decision, or a family decision is taken that you should go in for transplant. As I said, the important test is a pulmonary function test. So when we speak about the pulmonary possibilities of the pulmonary disorders, the one which comes to our mind is the presence of tuberculosis. So should I be screened if I'm enlisted for transplant? Should my doctor screen for the presence of pulmonary tuberculosis? Almost all of us will have subclinical tuberculosis, because India is endemic for tuberculosis. So it is better that we are checked for the presence of a latent tuberculosis. So the answer is yes, we need to be checked. So are there any tests? The answer is yes, there are certain tests which the doctor will get it done, like chest x-ray, man-tooth test, and in some special situations, certain assays which help us in identifying whether you have tuberculosis. Because if you have tuberculosis, it's better to get treated if it's an active phase and then only going for transplant, rather than transplanting the patient when there is an active tuberculosis, because tuberculosis definitely will be more detrimental in the background of a renal transplantation. So it's better to treat a patient of tuberculosis with the anti-tuberculous drugs which are available, and then going for a renal transplantation. Now, coming to the other aspect of it, if a cardiac disease is there. So if a cardiac disease is there, then you need an assessment. Basically, we need a cardiology clearance, because all of you know that a patient of kidney disease has an impact on the heart. So there will be hypertension in many of us, majority of us. So there will be an echocardiographic change which will be there, an ECG change which will be there. So all these things need a cardiology clearance. So apart from this, if I had a vascular disease, then if I had undergone stenting, if I had undergone if I had a history of myocardial infarction, then, so these are not absolute contraindications, but then we need a cardiologist opinion when we have a history of ischemic heart disease, when we have a history of stenting. So all these things need a particular assessment by the cardiologist. They will assess the type of involvement, the extent of involvement, and subsequently whether you need to undergo an invasive test or a non-invasive test. So definitely we need a cardiology clearance before undergoing transplant. The variety of tests can vary from the non-invasive test to the invasive test, taking up to the angiogram as well. So do not be at uncomfortable levels if you are being subjected for angiogram. This is only to give a clearance or probably a caution with respect to the underlying cardiac disease. Then if I have another vascular disease, that's a neurological disease. If I had a history of stroke, probably I need to wait for about 6 months. If I had a history of transient giddiness, which the doctor tells me that I had a transient ischemic attack, then I should wait for 3 months. But if I have a progressive neurodegenerative disease, then I should not undergo transplant. This is a contraindication. So what I mean to say is the history of stroke is becoming common. Even we had subjected a patient of past history of stroke for transplant, but we waited for about 6 months. This is in fact according to the guidelines. So wait for 6 months if there is a past history of stroke. Then coming to the last element of my talk, that's about the finances. The finances are definitely a crucial, sensitive, and most important part when you think about the transplant. We should be well supported as far as the finances are concerned, because transplant is definitely costly in the corporate sectors compared to the government hospitals wherein you get a free transplant. So this is very, very, very important aspect. In fact, in India, if you look at the cost ranges, it ranges from 5 lakhs to about 12 lakhs, and it may go up to 12 lakhs for a minimally invasive surgery, just not a surgical perspective, but then the cost of 25,000 to 30,000 per month for the post-transplant situation, again, becomes a huge financial burden for the family. So we should be geared up for the financial support across the family or across any insurance schemes that we have. But in certain states, there are free cashless schemes which support the patients for lifelong immunosuppressive therapy, such as in our state of Telangana, where the patient is given free of cost surgery, free of cost medicines, just not for 3 years, but then lifelong. So finances definitely from a crucial part. Most common cause for the graft failure is non-adherence and non-compliance to the therapy because of the financial disadvantage. So this needs to be looked into before you jump into the transplant. Otherwise, our graft will not sustain and we may not have a good graft survival or the patient survival. So basically, these are various factors that the kidney transplant costs in India, such as the type of procedure that you choose, the type of hospital that you choose, the type of immunosuppressive drugs that you choose, and of course, if there is an operating surgeon's fee, the medicines that have been described, the stay period, everything comes under the cost of the transplant. So from this perspective, if you're choosing a hospital on the high end, definitely be prepared. But if you're choosing a government hospital with particular schemes, then definitely you can relax, because under that schemes, everything will be provided free of cost. So these are the 5 elements which I wanted to speak about. In fact, finances may not be the medical or the scientific criteria, but then it's a logistic criteria which needs a lot of family support and a financial support from whatever source it may be. So this forms a crucial element of a successful transplant as well. So my take home in this short talk is kidney transplantation is an effective mode of kidney replacement therapy, which is supposed to be associated with long-term survival. This everybody knows. But certain factors need to be evaluated before taking up or before subjecting ourselves to transplantation, such as starting from age to serological status, to cardiac status, to pulmonary status. An appropriate cardiopulmonary evaluation needs to be done by the experts. If clearance is given, we would go ahead with that. Finances and adherence to the therapy form the crucial pillars of a successful transplant. Thank you, everyone. Thank you so much for your patient hearing. Thank you, everyone.